Okay, think about this for a second. You do a load of laundry. Maybe it's uniforms for someone working in healthcare, maybe just your regular clothes. Feels clean, right? Job done. But what if that simple chore, something we barely think about, is actually tangled up with a really big public health issue? I'm talking about hospital-acquired infections, even antibiotic resistance. Today, that's exactly what we're diving into. We're going to unpack some pretty startling new research. There's a study in PLoS ONE looking at domestic washing machines, the one in your kitchen or utility room, and healthcare uniforms. And these sources, well, they suggest that your home laundry routine might unknowingly be playing a role in some serious health risks.
Yeah, it sounds mundane, laundry, but it's critical. You see things like uniforms, any healthcare textiles, really. They can act as what we call fomites.
Fomites. So basically surfaces that carry microbes.
Exactly. They can transmit infections. And here's the thing. In the UK, something like over 80% of nurses wash their uniforms at home in their own machines. So the big question becomes, are these home machines actually getting things disinfected? Or could they maybe be inadvertently helping superbugs spread?
That's quite a thought. Okay, let's get into that PLoS ONE study. What did it actually find about how well our home machines perform? Because I think most of us just assume, a 60-degree wash sorts it out.
Well, you'd certainly hope so. But the findings were quite surprising, really. Only about 50% of the domestic washing machines they tested actually achieved what we could call sufficient decontamination.
Sufficient decontamination, what does that mean in practice?
It's technical, but it's a 5-log reduction.
Yeah.
Basically killing 99.999% of the bacteria, sterilizing, effectively. And that was only achieved by half the machines, even at a full-length 60-degree cycle. The rapid cycle. Even worse performance. A lot of machines just didn't get hot enough or stay hot enough for long enough. They did about 10 minutes at 60 degrees Celsius.
And they weren't hitting that.
Many weren't. One machine they tested, believe it or not, barely got above room temperature. It peaked at like 20 degrees Celsius.
20 degrees. Wow. Okay, so half the machines aren't really sterilizing properly. That's concerning. What about the machines themselves? Are they clean environments?
That's another key finding. They're far from sterile. The research showed that these machines actually have their own microbiomes, their own little ecosystem of bacteria.
Living in the washing machine.
And not just harmless stuff. They found potentially pathogenic bacteria, things like Mycobacterium, Pseudomonas, Acinetobacter, sometimes making up a pretty significant chunk of the bacteria present. And, crucially, they also found antibiotic resistance genes inside the machines, genes for things like efflux pumps.
Efflux pumps, those are the things bacteria use to pump out antibiotics, right?
To protect themselves.
Precisely. So the resistance mechanisms are already present right there in the machine environment. Okay, this is building quite a picture. But then there's the detergent angle. This part really stood out to me. What happened when they exposed bacteria to common laundry detergents?
Yeah, this is where it gets particularly alarming. They simulated repeated exposure like you get wash after wash, and the bacteria developed massively increased tolerance to the detergents.
How massive are we talking?
Well, take Staphylococcus aureus staph A. It showed an 89,000% increase in tolerance to one liquid detergent. 89,000.
Good grief.
And Klebsiella pneumonia, even more staggering. Over a 1.5 million% increase in tolerance.
That's hard to even comprehend, a 1,000,000% increase. But does being tolerant to detergent automatically mean anything for antibiotics? Is there a link?
A direct one. That's the critical point. This isn't just about surviving detergent. The research clearly showed that this repeated exposure induced cross-resistance to antibiotics.
Cross-resistance. So becoming resistant to one thing helps you resist another. Exactly. Klebsiella pneumonia, after detergent exposure, developed resistance to carbapenems. Now, carbapenems are often our last resort antibiotics for serious infections. So effectively, the detergent exposure turned it into a CRE, a carbapenem-resistant enterobacteriaceae.
A superbug, essentially, created through detergent exposure.
Yes. And similarly, Staphylococcus aureus became resistant to multiple antibiotics. It essentially became an MRSA strain, methicillin-resistant Staph aureus. They even identified specific genetic mutations happening in those efflux pump genes we mentioned, like MGRA and Staph aureus and ACR and Klebsiella, showing how this resistance seems to be developing.
So let's just process this. For you listening, whether you're directly involved in healthcare or just doing your laundry, this research seems to be saying, inadequate home laundering isn't just about whether clothes look clean. It could be an actual pathway for these dangerous resistant bacteria to travel from hospitals into our homes via uniforms, maybe survive the wash, and then potentially spread further, maybe even back into healthcare settings. That's absolutely the implication. It really shifts how we need to think about infection control.
Yep.
It's not just about wiping down surfaces in the hospital anymore. Our practices at home, specifically how healthcare uniforms are laundered, seem to be a really critical and probably overlooked part of this whole puzzle. The research definitely screams for, updated guidelines for healthcare workers, making sure
Right.
wash temperatures are actually being met, using detergents that are proven effective, maybe even considering industrial laundering more seriously where it's feasible.
It really drives home how these everyday habits, things we take for granted, can have these huge, far-reaching consequences for public health. So, thinking about all this, what really stands out to you about how we handle cleaning in our homes? Especially when we're dealing with items coming from potentially high-risk places like hospitals, it definitely leaves us with a pretty provocative thought, doesn't it? Could your washing machine, that unassuming appliance, actually be a hidden front line in this massive fight against antibiotic resistance?